Good afternoon, student. So, today is our special lecture on the role of the homeopathy in surgery. So, what is the surgery? Surgery is an art. It is that branch of medicine which is concerned with repair, removal, or replacement of the diseased tissue. In other words, any cutting, suturing, and repairing of the human tissue. So, surgery is the repair, removal, or replacement of a diseased tissue. That is, any cutting, suturing, and repairing of the human tissue. In medicine, surgery from the Greek word or chirurgical and Latin word that means is handwork. So, surgery is a handwork. Is a medical specialty that uses operative manual and instrumental techniques on a patient to investigate and or treat a pathological condition such as disease or injury to help improve bodily function or appearance or sometimes for some other reason. So surgery is meaning is the handwork and it is operative manual and instrumental technique so in which we can investigate the pathological conditions such as disease or injury and help to improve the bodily function or appearance or sometimes for some other reason. An act of performing surgery may be called a surgical procedure, that is, operation or simply a surgery. In these contain the verb that is operating, meaning the performing surgery. Surgery can last from minutes to hours, but is typically not an ongoing or periodic type of the treatment. So, surgery is 1 2 hour long lasting and typically not an ongoing or periodic type of the treatment. Surgery is considered an invasive procedure. So, although it is sometimes difficult to determine when a medical procedure is considered surgery. So, it is an invasive procedure. A medical treatment that involves a cutting of a patient's live tissue is usually considered surgery of some sort. But, for example, hairs and nails are the dead tissue. So, cutting of that is not a surgery. It is the cutting of a patient's live tissue. Then, a medical procedure involving a drilling of a live tissue in a body would often be considered surgery. So, in the medical procedure, there is a drilling of live tissue. Is also considered in surgery. But mere piercing of a body is not necessary surgery since piercing is often done by taking the samples or draining the fluid from or injecting a material into the body or setting intravenous drips and usually does not require suturing to close the pierce open. So, in the surgery, there is a piercing of a body and is not necessarily surgery since piercing is often done for taking a sample. So, for taking a sample, draining the fluid, or injecting the material, or the IV drip is not surgery. Examples of surgery without cutting the body may include a debridement or clothing that is suturing or stapling, and open wound or applying a skin graft if done under the typical surgical condition. So, piercing, injecting, draining, IV drip is is not surgery but debridement, skin grafting, suturing, stapling is a part of the surgery. So these are the diagram of the debridement. Then skin grafting. In this you can see how there is a skin grafting in this one. Then when we see the history of the surgery, in the prehistoric culture there is a trepanation. That is, in the prehistoric culture had developed form of the surgery. The oldest for which we have evidence is trepanation, in which a hole is drilled or scabbed into the skull, thus exposing the dura mater in order to treat the health problems related to intracranial pressure and other diseases. So, in the trepanation which is present in prehistoric culture, there is a drilling of the skull. So, exposing the dura mater by drilling the skull. So, here it mentioned that there is the health problems are decreases as it is related to the intracranial pressure. So, this is the type of the trepanation is present in the prehistoric culture. Then, evidence has been found in prehistoric human remains from Neolithic time in the cave paintings, and the procedure continue in use well into the recorded history. So, in the Neolithic time, there is a cave painting and recorded history is present, so which we can recognize the how the prehistoric human does the surgery. Then, surprisingly, many prehistoric and pre-modern patients had signs of their skull structure healing, suggesting that many survived the operation. In modern day, that is in Pakistan, remains from the early Harappan, that is Harappa Sanskriti, early Harappan period of the Indus Valley civilization. See, that is 3300 BC shows the evidence of the teeth having been drilled dating back 9000 years. So, in the Harappan century, there is a Indus Valley civilization shows the examples of the surgery. Then, in the recent excavation of the construction workers of the Egyptian pyramid, also led to possible evidence of the brain surgery. So, here we can see a recent evacuation in the Egyptian pyramid, which we can see the evidence of the brain surgery. A final candidate for prehistoric surgical technique is ancient Egypt. So, in the ancient Egypt, there is a mandible dated to approximately 2650 BC shows two perforations just below the root of the first molar, indicating the draining of an abscess tooth. So, in the ancient Egypt, there is a two perforation of the root in the first molar, which indicate the abscess tooth in the 2650 BC in ancient Egypt. Then, the oldest known surgical text date back to the Indian physician, that is Sushruta. Sushruta is the father of the surgery, who taught and practiced surgery on the bank of the Ganga around 600 BC. So much of what is known about the Sushruta is contained in a series of the volume he authored, which are collectively known as the Sushrut Samhita. That Sushrut is the father of the surgery, and he collects his all the writing in a book which is called as the Sushrut Samhita. Sushrut Samhita is the oldest known surgical text and is described in great details. So, in there is an examination of the patient, diagnosis, treatment, and prognosis of the numerous elements. as well as procedures on performing the various forms of a plastic surgery, such as cosmetic surgery and the rhinoplasty. His technique for the latter used to reconstruct the noses that were amputated as a punishment for crimes and is practiced almost unchanged in technique of this day. So, the amputation is the punishment for the crime, that nose amputation. So, Sushruta reconstruct that noses and is practiced almost unchanged in the technique to this day. Then Hippocrates. So this is a diagram or the picture of the Hippocrates. Other ancient culture to have surgical knowledge include the ancient Greece, and the Hippocratic oath was an innovation of the Greek physician. The Hippocrates and ancient China. However, ancient Greek culture traditionally considered the practice of opening the body to be repulsive, and thus left known the surgical practices such as lithotomy to such a person as practice. So in the ancient time, in ancient Greece, there is a Hippocratic oath. It is the innovation of Greek physician. And in ancient China, Greek, he traditionally considered the practice of opening the body to be repulsive. So, thus left alone the surgical practices such as lithotomy. Then, Hua Tuo. In the China, there is a Hua Tuo was a famous Chinese physician during the Eastern Han and the Three Kingdoms era. So, he was the first person to perform surgery with the aid of the anesthesia. That Hua Tuo is the first person to performed surgery with the help of the anesthesia, and some 1600 years before the practice was adopted by the Europeans. So China is again just before to the Europeans. Then in the Middle Ages, surgery was developed to a high degree in the Islamic world. So in the Middle Ages, this is all about the historic time and the ancient time. But what happened in the Middle Ages? In the Middle Ages, there is Islamic world developed, and they develop a high degree of with renowned practitioners such as Abul Qasis and Andalusians, the physicians and the scientists who practice in the Zahra suburb of the Cordoba, and a great medieval surgeon whose comprehensive medical texts shaped the European surgical procedure up until the Renaissance. So he is also often regarded as the father of the surgery. This is the Abul Qasis. He is also regarded as the father of the surgery in the Middle Ages of Islamic world. Then in Europe, the demand grew for the surgeons to formally study for many years before practicing. Universities such as Montpellier, Padua, and Bologna universities were particularly renowned. So, in the Europe, there are the many universities which are particularly renowned for the surgery. By the 15th century at the latest. So, at the 15th century, surgery has split away by the physics as its own subject of a lesser status than pure medicine. It, and initially took the form of a craft tradition until Rogerius Salnetius composed his Church began laying the foundation for modern Western surgical manual up to the modern times. So, in the 15th century, there are the surgery split into the physics of that is of pure medicine and the craft tradition that is surgery until Rogerius composed that foundation of the modern Western surgical manuals. Late in the 19th century, the Bachelor of Surgery degrees, usually that is CHB, began to be awarded with the MD and the mastership became a higher degree, usually abbreviated that is CHM or MS in London, where the first degree is MBBS. So, this is the Rogerius. In the late of the 19th century, there is the Bachelor of Surgery degree, that is MBBS CHM or MBBS MS degree is abbreviated in London. The next is the modern surgery. The modern surgery developed rapidly with the scientific era. So Ambroise Paré, that is sometimes spelled Ambrose, pioneered the treatment of gunshot wound, and the first modern surgeons were battlefield the doctors of the Napoleonic War. So this is the picture of the Ambroise Paré, who is the pioneer of treatment of gunshot wound, and the first modern surgeon were battlefield doctor in the Napoleon War. So this is the evolution of the surgery. This is the Sushruta time, that is, who is the father of the surgery in 1600 BC. And in ancient time, this is a European that how they perform surgery, and this is a modern surgery. Naval surgeons were often a barber surgeon who combined surgery with their main job as a barbers. Three main development permitted the transition to modern surgical approaches: control of the bleeding, control of the infection, and control of the pain, that is anesthesia. So, main development permitted from ancient to modern surgical approach is that mainly the three control, that is control of the bleeding, pain, and infection. So, how to control the bleeding in the modern technique? So before the modern surgical development, there are a very real threat that patient would bleed to death before the treatment or during the operation. Cauterization, that is fusing a wound close with the extreme heat, was successful but limited. It was destructive and painful, and in the long term had a very poor outcome. So ligatures or the material used to tie up some blood vessels are believed to have originated with Abulcasis in the 10th century and improved by Ambroise Paré in the 16th century. So, before the modern surgical development, there is a very dangerous treatment for the controlling the bleeding as cauterization, that is fusing a wound close with extreme heat. So it is very dangerous in that it is very destructive, painful, and in the long term had a very poor outcome. Then second is the ligatures. Ligature or the material used to tie off which serve the blood vessels are believed to have originated with Abulcasis and in the 10th century and approved by the Ambroise Paré in the 16th century. Though this method was a significant improvement over the method of cauterization, it was still dangerous until the infection risk was brought under control at the time of its discovery, and the concept of infection was not fully understood. So, the method of cauterization is very dangerous and it has infection risk. But the concept of infection is not fully understood at that period. So finally, in the early 20th century, research into the blood group is allowed. Finally, early the 20th century, research into the blood group allowed the first effective blood transfusion, and the concept of infection was unknown until relatively new. So, in the early 20th century, there is a blood group evolution. That is the concept of, but the concept of infection was unknown until relatively in the modern times. Then Agnes Semmelweis. The first progress in combating the infection was made in 1847 by the Hungarian doctor, that is Agnes Semmelweis, who noticed that medical students fresh from the dissenting room were causing excess maternal death compared to the midwives. So, firstly, he found that medical students fresh from the dissecting room were causing excess maternal death compared to the midwife. So, Semmelweis, despite ridicule and opposition, introduced the compulsory hand washing for the everyone entering the maternal ward and was rewarded with the plunge in the maternal and fetal death. Hello, नाव काय सांगितलं? हॅलो, हां हां, कुठे आहे तुम्ही? बरं बरं. So there is a compulsory hand washing for everyone entering the maternal ward and was rewarded with the plunge in the maternal and fetal death. However, the Royal Society in the UK still dismissed this advice. His advice. So, Semmelweis found that there is a maternal death is occur due to the infection in which there is no hand washing. So he do compulsory hand washing to all before entering the maternal ward and was rewarded with the plunge in the maternal and fetal death. So, however, the Royal Society in the UK still dismissed his advice. Then the Joseph Listener.